Let's take a look now at the enhanced data collection. And this is a very unique type of data collection that you do not see in other surveys. And that's the reason why the enhanced is such a rich national survey. We've seen that since 1999, the data have actually been collected on a continuous basis on a 2-year cycles. You might see the different cycle described as the enhanced 1999-2000, 2001-2002, etc. And then as soon as the data are available, they're released to the public, but after they're being cleaned and checked. Every year, approximately 7,000 individuals are interviewed and 5,000 individuals are examined. So this is a really large sample. And if you're actually looking at some rare outcomes, then you might actually even be able to combine multiple years to increase the sample size. And there are ways of doing that that is not too complicated. And so you can actually make the sample larger. The interviews are initially conducted in the respondents' homes, and there are actually trained staff that are bilingual. They conduct the interviews. And then the participants are asked to go to these tracks, they're called the mobile examination centers, to perform examinations. So there is essentially these tracks that travel throughout the United States. There is groups of physicians, technicians, health interviewers that are work together and then travel in these trucks throughout the US. In fact, some of you might even want to be part of this team and participate. Something very unique to enhance are these trucks. What happens is the data are collected using these trucks. They travel throughout the US to collect the data because you need, inside these trucks you can see patients and do all of the exams that you need. So the patient will go up the stairs here through this door, and then they'll go from one truck to another and get all of the data collected and come out on the other side. So it's essentially a portable mega unit, clinic unit with lots of information that will be collected. In this diagram, you can see the 4 tracks and the inside, how they look. And this may vary a little bit from potentially different years, but essentially we have the participants would begin by entering the track from one side here, then continue moving through the different rooms where they get different tests and blood draws, then various measurements, and eventually they leave the finish and they leave that track. And so all of the information is collected at once in essentially in one visit. So that's what makes this survey a cross-sectional survey rather than even though it may be, the data may be collected over a long time because there is obviously a lot of participants to look at, but it is cross-sectional because the data are just collected on a person at one time point. The variables for a NINS are collected after the screening during an initial interview in the participant's home, and these includes demographics, socioeconomic, dietary, and health-related questions. Then most of the participants are asked to go to the mobile examination center to have an examination. And here the participants will have medical and dental examinations, physiological measurements, and laboratory tests. And during the examination, there will also be more in-depth interviews on selected topics that were initially asked earlier in the interview at home. And this may be specific to for example, to the age group of the participants. Now, what we want to keep in mind is this is not just a sequence of events, but also it is important to know when each variable was collected. If this in fact affects the analysis, because there will likely be more individuals who will participate in the initial interviews, and then fewer individuals will participate in the examinations. What this means is that the weights that we're going to use will be different. So if you have a variable, if you decide to analyze a variable that is included in the examination, you will use those weights rather than using the weights for the interview. So there will be different weights, and we will see that more in detail in future modules. And what is being collected varies somewhat from year to year, but there are also some core questions, core examinations that are done every year. And when you look at these and think about your own research, you can see that there is quite an extensive array of information, and then you can actually think about how you can actually combine these, because all of this is actually collected on a single patient. And so you can imagine the type of studies you can do, the type of analysis that you would not be possible, if otherwise. Despite the rich information available, there are also some limitations. The primary limitation is that the data have already been collected. And so if you have any specific question, you can only choose among the variables that are already available. You cannot create new variables. And sometimes these variables can be fairly generic. And so in that case, you might want to have a much more specific question that you are not able to answer. However, in general, ENHANES could be used also to spur new research, new ideas. So you can start with a more generic question and then use that as your preliminary data to develop your own study. ENHANES will provide very nice summaries, such as this one. So you can see in a snapshot what is being collected and when. Because different components, for example, smoking, vision, and so on, are collected only on certain individuals of certain age and also in certain years. And so this information can be readily available as you try to plan your study and the variables that you want to use for your analysis. After the data are collected, they are published publicly on the ENHANES website. In this case, for example, you will see that to the left, you will have questionnaires, datasets, and related documentation. So you'll find all of the information that you need on how the data were collected, and also you will have the actual data available to you for analysis.